What are grafts in rhinoplasty? In rhinoplasty, we use pieces of cartilage that can come from your septum, which is the divider between the two sides of your nose, inside your nose, your ear, or a rib, to create the appearance of the nose that we want. And so whenever we say we're using a graft, this just means we're using cartilage or even bone in some cases that is from somewhere else and placing it in that part of the nose. If it's from the septum, you're basically taking it from one part of the nose and putting it in another. Or if it's from the ear or the rib, you're putting it from one part of the body to another. What are tip grafts in rhinoplasty? A tip graft is a cartilage that we carve into what looks kind of like a heart that is placed at the tip of the nose. This can be angled in different directions to make the tip look more projected, give it a little more definition. This can create length on the nose if you place it underneath the tip. If the nose is over-rotated and it looks like a shorter nose, you can create more length in the nose by just adding that extra bit of cartilage. Or it can actually rotate the nose depending on the way that you place this. It acts to augment your own tip of the nose and create a little bit better definition or rotation that we want. What are spreader grafts in rhinoplasty? The way I describe spreader grafts to my patients is they look like tiny 2x4s. So it's that shape, but teeny tiny and almost 2x4 millimeters, probably not even 4 millimeters. And so they're a rectangle of cartilage that I take from your septum, from a rib, sometimes from the ear, but not as often there because the ear cartilage is curved and it's not, I want something that's very straight. And I'll carve that into that little rectangle that goes in between the cartilage on the side here and the septum in the middle. This widens this middle part of the nose ever so slightly, more on the inside than the outside. So if you've ever used breathe right strips or held your nose open to breathe like this, that is exactly what it's doing. It's opening that valve that we call the internal nasal valve, and that's actually the narrowest part of the airway. So whenever you breathe in, that's the bottleneck of the air. So if you can open that only by just a few degrees, you can feel a lot more air go in. So these have two different functions. One is that to improve the function of the nose and get more air through the nose. And the other is to improve the appearance. And so in some noses, you'll see the nasal bones are a bit wider and then it gets more narrow and then the tip is wider. With spreader grafts, we're able to make that nose look more smooth and even all the way down from the top of the nose to the bottom of the nose. Have questions? Schedule a consultation anytime. I help people like you every day. Thanks for watching.